Okay. Hi, my name's Julie Brewster. I've been a physical therapist for 28 years, and in about 2008, I had a back injury and started working. I worked with the elderly for about 14 years in nursing home care. And after my second back surgery, I started working in outpatient, and I needed to discover how to move better because my back was a problem. So I started doing like a lot of movement reeducation classes, and in a different way than what physical therapy does, just more holistic movement. And in that journey, I found out about Ortho-Bionomy. It's a way to, so with movement, if you don't have the mobility that you need at each joint, you can move improperly, or it's difficult to move, right? So Ortho-Bionomy was a super gentle technique that is profoundly comfortable and effective in gaining motion. So in order to supplement my movement practice, I started studying Ortho-Bionomy. It's done fully clothed. You can get on the skin if you need to, whatever, but it's basically finding a position of ease and staying in that position until the body is ready to move. And there's different signs to a release, when a release happens and the body resets. So if you wanted to kind of experience what that is, if you just move your shoulders up and move your shoulders down, and what you're going to do is what we find is the position of neutral. So kind of move it up and down and find the place that feels like there's the least amount of tension. So it might not be all the way up, and it might not be down, but maybe somewhere in between there's a point where it's kind of like nicer than the rest, right? And you're not really working as hard. And then you hold that until there's a release, whether it's I'm tired of being there, or maybe you feel gurgling in your stomach, or you take a deep breath. And then you can relax once that releases. And then you can kind of notice the tension is less after you do that. The other thing you can do is a neck motion, just for playing around here, getting a little experience. But if you turn your head right, turn your head left, and kind of notice which way it turns better. Which way does it turn further? Where's there less tension in your neck? So go ahead and move it to that position where there's the least amount of tension, and leave it there until either, like the signs of a release are you're bored, it's no longer comfortable anymore, take a deep breath, gurgling in your stomach, those kind of things, and then you just move back and then retest it and see how the motion is, and did it increase? Is it better going to the side that was more difficult? So you can do that. Pretty amazing, huh?
Yeah.
What did you experience?
I noticed it right away. When I turned right, that was my most comfortable. I turned left, there was definitely more tug and pull, it felt like. Then I did that, and I went back, and I just was a lot more smoother.
Yeah, did anybody else notice anything?
Yeah, I did. I did too. It was just very comfortable. It was like I had more. I was able just to move a further distance.
Yeah, like less tension. Or
Exactly.
something.
Yeah.
So that's like a small example, but I mean you could take it at any joint, and you can do it yourself too. It's not a rocket science really, but it is a feel. And that's another thing that brought me into Ortho-Bionomy, is like, as a physical therapist, you want to, this is what it should look like, this is what it does look like, so we're going to make it look like that. You know what I mean? So there's a lot of forcing in physical therapy, and this is how you do it, this is how you do it. And the Ortho-Bionomy, there's no forcing, there's no pain with it. If there's pain with it, you're not doing it right, or you've gone too far one direction or the other, So it's super comfortable and yet profoundly effective like pretty quickly, right? So I work with necks, backs, shoulders, feet, whatever. And there's a general, after a treatment, there's just a general feeling better. Like sometimes it's hard to like really pin it down, but you move better, you feel better, you have less pain. So, and so it really does cater to the elderly because they don't have to get undressed, they don't have to get under a table on a, you know, I could do it in their homes. It's obviously more comfortable with me with my back history on my high-low table in my studio, but I can come to them and help them in their homes. So, do you have any questions about that? Yeah.
How long has this practice been around?
Since I believe it's the early 70s. Lincoln Arthur Pauls was a osteopath. He was a judo instructor, and he'd go get fixes and then send his students down the road to the osteopath to get corrected after fighting and stuff. And then the osteopath down the road said, maybe you should actually study this, and then you could just have your whole practice right there. And he discovered it. Positional release is a type of like strain, counter strain. Some people have heard of that, but it's kind of based on that. Then he kind